The VMAP program is essential. There is no way that this should ever be decreased. There are so many children and young adults who need these kinds of services, and there's a need for more specialists in the mental health space. I have reached out through the consult line, and the response, I work after hours often, and so I've called and left messages on the telephone consult line, and I get a call back first thing the next morning. The care navigation system is fabulous, and they reach out to families right away, and the families have been very satisfied, and they then reach back through the practice so that you can track what's going on and keep that in the patient's medical record. You make that phone call, and that family is serviced so quickly, where it would take me much longer.
In a lot of my practice, I do mental health care for adults, and I've done some for adolescent for sure. But I've always been like, I have a few more questions. I want to be able to manage that care better. And so I've learned about the VMAP REACH program through the Virginia Academy of Family Physicians, and was excited and reached out. I took the course a month ago. It was a weekend course over 2.5 days. And it was an incredible experience to really dig deep into pediatric mental health in ways that I haven't had an opportunity before in my training, to get connected to VMAP and the resources that are available for us in primary care. Because I do see kids, but I don't see as much volume as a pediatrician does. And so it's really helpful to be able to reach out to a child psych specialist when I have a case that I want to review, because access to that care is so challenging. About a third of my patients are undocumented and Spanish speaking, and half are uninsured of my entire panel. And so, as you can imagine, the access to all healthcare, including especially mental health services, is really difficult for that community. So having this support, having deeper training for my own skills, and then having the backup with VMAP is really powerful for them. It's clear that this is a very, very valuable experience. It's something that me and my independent small practice would not have been able to afford without the support of VMAP funding it and through the funders that are supporting. So I really appreciate that support.
I've called the VMAP line many times. I've called them at least, I would probably say either me or one of my trainees have called the VMAP line probably at least 2 times a week since we learned that it existed. It has been impossible to help families navigate their insurances. And so now it feels like we can do something to help support the family. And so essentially anytime a family is interested in therapy, for the most part, we call VMAP. Yeah, so calling the VMAP line has been a much easier process than what we were doing before. Before was really entirely on the family hands. And because of the patient population that we see, which is a majority Black, young individuals and their family members with like low SES, and they just have a lot of their own psychosocial stressors that are going on. And so now we can really provide support. And by we, I mean calling the line. So VMAP can really provide that support and that follow-up, which has been very helpful. I have multiple, I guess, like quote unquote, success stories. And I also think they're successful for a couple of reasons. A, because they've established care with a therapist after attempting multiple times, not knowing how to navigate insurance coverage, and also just like assuming that they didn't have many options because of insurance, because we generally see primarily a vast majority is Medicaid. And so they kind of are just like, well, we probably don't have a therapist that's going to be covered. And so to see a list of multiple programs that you all have found and seeing them become established, but then also because of this like circular process and this follow-up, their success stories, because I know that patients are actually getting into therapy, which I wasn't seeing before.
The amount of mental health issues that primary care pediatricians would be taken care of in the office, but we obviously needed some help as well, because it can oftentimes be just outside of our immediate area of expertise. So then I found out about VMAP, and particularly the VMAP line, which has been gosh, I mean, an incredible resource for me. I mean, there are few weeks that I go an entire week without calling the line up and finding out placement for a patient or potential placement for a patient. It is amazing. I think it absolutely is a lifesaver. It makes a huge difference in the lives of these children and their families when they have nowhere else to turn, and they have looked under every stone that's out there. So it's really incredible to talk to someone on the VMAP line who can tell me, sure, we'll figure out, something for, this family or for this patient. And then in my inbox just a few days later, I get a curated list of referral opportunities that's been forwarded to a family. And it's just incredible. That works. I mean, VMAP works so well with that. I'm just really amazed. I think we'd have fewer problems in healthcare if everything else worked as well as VMAP does. I definitely had just an amazing experience with psychiatric consultation for a teenage patient. And it was absolutely just, I think, the best consultation experience that I've ever had, no matter what the specialty is, no matter what. I think I spent almost an entire hour on the phone with the psychiatrist, going through, every facet of this teenager's care. So it definitely gave me the tools that I needed to really help this family out and to keep them out of crisis so they did not have to go for psychiatric admission at a hospital.
I think there is more buy-in for mental health, knowing that, hey, I talked about the situation, the screening, the tools, and with their permission, I was like, can I share this with the psychiatrist? It makes it easier for you to move forward as opposed to waiting to see a psychiatrist. We've lost valuable time. So I think parents really appreciate the transparency, and they love knowing that I've consulted a specialist in that field, because we are a teaching clinic. And I'm very much involved in medical education. So I'm always telling VMAP, I have the book next to our third year and fourth year medical students. I have family medicine residents rotating to them. I have greatly benefited from VMAP call line, the REACH, the ECHO. I was very comfortable with a short list of diagnoses. But since I took the REACH program, I've definitely grown in my comfort with how to screen for different disorders. How to appropriately ask the question. And then I think with the repetition of all the REACH courses and the Project ECHO discussions we've had, that confidence, and then also feeling confident when calling the VMAP line and talking to the psychiatrist, really giving them a good platform to build on and help me help the patient in turn. And even if after taking the REACH course, if you didn't feel comfortable, you had the VMAP line to confirm, hey, this is what I'm doing, is that okay? I like the QI project option within the Project ECHO. And one of the QI projects that I did was using the PSC 17. That was a screening I had no idea existed before I took REACH. So it was nice to actually learn about it in REACH and then apply it. And then now it's become part of our routine clinic. I think VMAP is probably the best public resource to actively train physicians to provide mental health care. Actually, I do have a patient I need to call about, and I plan to call them today. Because why wouldn't you?